ultrasound of a female, young female, age 27 years, married 3 years, history of primary infertility. At this time, she presented with pain in the right adnexa or pelvic region, right? What I'm showing you at present is that this is the urinary bladder, and as I move the probe towards the right adnexa, you will see there is a thick-walled cyst with internal settled down dependent region echoes, and there is fluid also seen. These are the bowels, and let's first concentrate on this pathology. This is the cyst, right ovarian, complicated cyst with dependent region echoes measuring approximately 29 into 30 mm, is thick wall. You see, this is the wall. This is the wall, and it is thick up to approximately, 2.6 mm is the wall thickness, and there are internal septals as well. You see, these are the thin and thick septals. This is the thin one, and this is the thick one. And you will see there are small follicles also. And not only that, here you will see this is a fluid ring. This is fluid. And in fact, the pain that she is suffering from is because of the torsion of the ovary that she is going through. Now this is the thick wall of the cyst. You can note the posterior wall enhancement, dependent region settle down, echoes giving fluid level, and no calcification or solid element is seen in this cyst, and it is in the right adnexa, it's the right ovarian cyst. This is a small amount of fluid which is suggestive of this pathology being that of torsion and ovarian cyst. And another important thing that we should always analyze in all cases of cyst is whether it changes its shape or not. Now I am going from transverse, this is the transverse, and from the transverse I am going to give a sweep to this cystic area, trying to keep it in the center of the screen, and now I have given it approximately 180-degree sweep, and you saw that it did not change its shape. And this is, you can see here is the fluid in which you can see the bowel movements. This is fluid, and these are the bowels you can see moving within it. So case of number 1, torsion ovarian cyst right side as a cause of her pain. Now the another interesting feature is that there are two structures, tubular structures seen as now when I move the probe longitudinally, I see the uterus. Now this is the uterus, measuring 5.7 centimeters by 2.8 centimeters. Is small in size, in length, otherwise it's okay in width. This is the endometrial canal, this area. This is the urinary bladder, this is the cervix, and this is the vagina. So this is we are seeing in this position because the bladder is inadequately filled. Because of her pain, she cannot retain the urine. This is the endometrial canal, and the endometrial canal measures 8.4 millimeter. Is clear, is central, and here you see these this area is the cervix, and this is the vagina. This line, this is cervix. Now when I move the probe posterior inferiorly, I come across another tubular structure which is giving the shape of a uterus, and this is the second uterus in this female. It is retroverted, rather retroflexed. Here we are. You see, this is the endometrial lining, this is the endometrial line, this is the vagina, and here is the cervix, part of the cervix, and it measures 4.6 centimeter by 2.4 centimeters, is small in size, and this is the endometrial canal. Now one uterus is retroflexed, this one. This is the uterus that is almost retroflexed out. Here now in this shape, in this being seen as see, this is the uterus, this one. Outer surface, posterior surface, endometrial canal, anterior myometrium, posterior myometrium. This is the cervix, and in this dimension it measures 5.7 centimeter by 2.5 centimeters. Okay, so this is the uterus number 1, fundus of the uterus, anterior myometrium, posterior myometrium, cervix, vagina, fine. And as I move the probe transversely, I can see now this is the uterus number 1 in transverse section. This is the endometrial canal. Here is the uterus number 2 with the central clear endometrium. This is the transverse section of the uterus number 1. This is the longitudinal section of the uterus number 2. And here is the right ovarian cyst with fluid posterior to it, as well as along its sides, and this is the torsion ovarian cyst right. So we can see all the three structures together in this particular view. Applying the Doppler gives us no significant information. Here we are. And yeah, the important thing, whether this is the cervix, you can see the cervix is elongated. Now the cervix is not seen in this naturally 4.4 centimeter by 4.3 by 1.1 centimeter. This is the cervix. It's unusual to see such a length of the cervix. And if you want to correlate that whether there are two cervices or there is one cervix serving the function of both, and there is one vagina. Yes, there is one vagina. These are the vaginal echoes, and it is being shared by both this uterus number 1 as well as this is the uterus. See, now you see this is the uterus number 1, this is the uterus number 2. Both are sharing the same vagina, and so far as cervix is concerned, the cervix is also being shared by both of them. This is the cervix which is relating to this uterus as well as the other uterus. Here. So we do not see two separate cervices, and one vagina, one cervix, two uterine bodies is the ultimate conclusion. And this is our case of the day. Thank you very much.